Hi. So let's start with kidney physiology. Okay. New topic. Right kidney is lower than the left kidney because of the liver. Okay. Because right side liver is present. So nephron, basic functional unit of kidney. 1 to 1.3 million nephrons are there per kidney. So in both the kidneys, in total we have 2.6 million nephrons. This is not important. This is length of the parts of the nephron. Length of nephron in total, 45 to 65 millimeter. Okay. PCT is 15 millimeter. DCT is 5 millimeter. Thin descending loop of Hanley is 2 to 14 mm. Thick descending loop is 12 mm, and collecting duct is 20 mm. Now, there's a difference. This is very important. There's a difference between cortical nephrons and juxtamedullary nephrons. The part in which cortical nephrons are the nephrons which are present in the cortex, and juxtamedullary nephrons are the part which is present in the medulla. So this is 85%, which is maximum, and this is 15%. Okay. Cortical nephrons have small glomeruli. Glomeruli is this. Okay, if you have forgotten, glomeruli is small, present in the cortex, which is present in the cortex. Here, the glomeruli is large and present at the corticomedullary junction. Then, thin and thick segments in the loop of Henle are present. Both are thin. Both are thin, and here in cortical nephrons, thin and thick segments are present. The loop is shorter. Here, the loop is longer. Functional function is filtration. The cortical nephrons do filtration, and juxtamedullary nephrons do countercurrent. Supply is peritubular capillary network, and here it is vasa recta. Oxygen is consumption is very high in the cortical nephrons because the function is filtration. Okay, and the in the juxtamedullary nephrons, oxygen consumption is low. More blood flow is here, more blood flow required, and here less blood flow required. And PO2, partial pressure of oxygen, is more, 50 mmHg, and here it is less, 15 mmHg. Filtration rate here is slow, and here it is high. Okay, now the structure of nephron. Okay, this is the part which is present in the cortex, and this is the part which is present in the medulla. This is the loop of Hanle. This is PCT, this is DCT, this is the thin descending loop, this is the cortical nephron, this is the thick ascending loop, this is the thick ascending loop ka distal part, this is the proximal part, this is glomeruli, is the network of blood capillaries, efferent arteriole, and this is the Bowman's capsule, which have podocytes and all, and combined both glomeruli and Bowman's capsule, it is called as renal corpuscle. Okay, this is PST, proximal straight tubule, and yes, and this is the collecting duct. Okay, now the part structure present in cortex. Efferent arteriole, peritubular capillaries, interlobular arcuate, interlobular arteries, PCT, glomerulus with Bowman's capsule, which is combinedly called as renal corpuscle, and distal part of TAL, thick ascending loop of Hanle, distal part, and juxtaglomerular apparatus, cortical collecting ducts, and DCT. Now, structures present in medulla: straight part of PST, descending loop of Hanle, proximal part of ascending loop, thick ascending limb, medullary collecting duct mean, uh, ascending and descending vasa recta. Five things. Here 10. Now, the structure of kidney. The structure of nephron, sorry. Um, First is Bowman's capsule, which is made up of squamous cells, which it is present between visceral and parietal layer. Bowman space. Okay, it is present between visceral and parietal layer. Now, glomerulus, tuft of capillaries, pressure there in capillaries is 45 mm Hg. Elsewhere in body, in glomerulus, the pressure is 45 mm Hg. Elsewhere in the body is 25 mm Hg. Function is ultrafiltration. The pressure in glomerulus is high. Now, filtration barrier. What is filtration barrier? This is the structure. This is glomerulus. Okay, capillary network. These are fenestrations present the gap between the endothelium cells. Black one is endothelium cells and red one the gap is fenestration, which is 70 to 90 nm thick. Okay, 70 to 90 nanometer thick, and here the cells are, this is the Bowman's capsule, this is the basement membrane, here podocytes are present, the gap and this surface of the podocyte is called as pedicles, and the gap between this is called as filtration slits, which is 25 nm. This is thicker gap and this is thin gap, very small gap, slit diaphragm, which is similar to tight junctions. This is Bowman's capsule. Now this side is capillary lumen side. Okay, because there, because here capillaries junction glomerulus is present. 4 to 8 nm size of a substance pass through it. Yes, here in spite of the gap 25 nm nanometer, but the structure pass through it has a size of 4 to 8 nm, because if we put a sieve, a thick slit sieve, and then below it we put a thin slit sieve, but the structure pass, the thin is like 25 nm and the thick slits have 70 mm, but two slits combined will give the slit size very small, so 8 4 to 8 nm. Okay, now three layers are here. Podocytes with the filtration slits. Okay, glomerular basement membrane, and glomerular endothelial fenestration. Okay, now PCT. Brush border epithelium. In proximal convoluted tubule. In Bowman's capsules, there are squamous cells, and in PCT, proximal convoluted tubule, the brush border epithelium is present. Every substance is maximally absorbed in PCT except magnesium. Every substance is maximally secreted in PCT except potassium, which is secreted but not maximally. Okay. Now, loop of Henle. Thick descending and thick ascending loop. Flat attenuated cells, passive transport. Okay, thick ascending, low cuboidal cells, active transport. In thin descending loop of Henle, flat attenuated cells are present because it is thin, so thick. So there are very less space, so flat cells, attenuated cells are present. Passive transport is present with no ATP, and here low cuboidal cells are present in thick ascending, and active transport is present. AI, we can remember it through this. Ascending is impermeable, are impermeable to water. Okay, and the ascending limb is impermeable to water. AI, artificial intelligence essay, we can remember it like AI, ascending limb is impermeable to water. Ascending limb is impermeable to water. So yes. Okay, then collecting duct, which has clear cuboidal cells. There are two type of cells in the collecting duct: P cells and I cells. P cells are principal cells and I cells are intercalated cells. okay, which are further divided into alpha and beta cells. Brown cells we also called as intercalated cells, we also called as brown cells, okay. Yes, now the difference between both is in P cells, sodium and hydrogen reabsorption take place, and in I cells, acid secreting cells, they are acid secreting cells. Okay, so P cells, reabsorption of sodium and water, increase BP. Okay, potassium secretion, because sodium is absorbed, so secretion of potassium, less organelles are present, numerous in number. So aldosterone act here in P cells, okay. And here I cells and the chelated cells, alpha, which is further divided into alpha and beta cells, also called as brown cells. Acid secreting cells are there, helps in the bicarbonate transport. More organelles are present here and fewer in number. P cells are more numerous and have less organelles. Okay. Juxtaglomerular apparatus. It is very important. Cortex. Juxtaglomerular apparatus have four types of cells: JG cells, macula densa, Lecis, and mesangial cells. Okay. So, what is the function of JG cells? JG cells produce renin, modified smooth muscle cells of afferent arteriole. These are the cells which are the cells of afferent arteriole, smooth muscle, modified smooth muscle cells of afferent arteriole, produce renin. Sorry, these are just before entering the nephron. Afferent arteriole is the one. Baroreceptors are present here, and stimulus is hypovolumia. This here they uh, act because of hypovolumia. Like stimulus is required, so hypovolumia is the stimulus. If the volume decreases, then these become active. Okay, and produce renin. Innervated by sympathetic system. Now, macula densa. In relation to DCT, these are present in afferent arteriole, these are present in DCT. It is specialized cells of TAL, thick ascending limb. Okay, thick ascending, and marks the beginning of DCT. Okay, these are present in thick ascending limb but marks the beginning of DCT. So they are in relation to DCT. Near to afferent arteriole. These are near to afferent arteriole. Function is chemoreceptor. These are chemoreceptor. These are baroreceptors. These are so sodium and chloride. Like stimulus is change of sodium concentration. They are not innervated. Lecis cells are extraglomerular cell supporting cells. If these two don't work, then Lecis cells come in the picture. And mesangial, one type of cells are also present. Polkison cells. Okay, mesangial cells, when they contract, GFR decreases. If the mesangial cells constrict, the GFR decreases. In extreme cases, they show release of small amount of renin. In extreme cases, they show release of small amount of renin. Also, intraglomerular cells. These are also called as intraglomerular cells. So, when they contract, GFR decreases. Renin, don't confuse renin with renin, which is with double N. This renin with double N is an enzyme, and this renin we here study. This is a kidney hormone by J.G. apparatus. Now, in the next, we will study RAS, renin angiotensin activating system.